Is there a doctor in the house? Is there a doctor in the house?
Step away from WebMD. You don't have that disease. You've got something better. The Beach Medical Health Cast. Healthy, wealthy, and beautiful. With Dr. Ryan Naughton. And yeah, he's definitely better than Dr. Google.
What's up, Doc?
If you're drinking more coffee than water just to stay awake, your hormones, not your habits, might be to blame. Good afternoon. I'm Dr. Ryan Naughton, and I help busy men and women look, feel, and perform their best through hormone optimization, weight loss, aesthetics, and regenerative medicine. Today I have Lady Atahortua, our nurse practitioner here at Beach Medical, with me, and we're going to talk a little bit about hormone balancing.
Hi, everybody. I'm excited to be here. Let's talk about hormones.
Awesome. So I just kind of want to get started. Hormones is a broad topic.
Yes.
So when we talk about hormones, we're talking about testosterone, estrogen, progesterone, thyroid, and maybe a little cortisol in there.
Mm-hmm.
And men and women both have all 5 of those hormones, just in different levels. So a man's dose of testosterone is about 50 times that of a female's. But we also have progesterone and estrogen in our bodies as well.
Mm-hmm.
Hormone balance is crucial for your metabolism and energy.
Yes.
So how might we know that we might be having symptoms related to hormones and not just a caffeine deficiency?
Well, for women, let's talk about perimenopause and menopause. For women, not many times, a lot of women go through perimenopause in the mid-30s. They can start having symptoms. Some of those symptoms that our patients come in with are having trouble sleeping, poor concentration at work, hot flashes, weight gain, mood swings worse than normal, sex drive, low sex drive. So they're just not feeling themselves. So they come in, we have a consultation, talk about all those symptoms, and then we get lab work, right? We check their hormones, all the different blood counts, and then 99% of the time they have a hormone imbalance. It could be the estrogen, progesterone, testosterone, or all 3. So then we come up with a plan to help them. And usually within 6 weeks, they start feeling back like they used to.
And so I'm a medical doctor. My training's in medicine.
Yeah.
So I think the majority of practitioners, they look at the symptom, and we have medication for most of those things,
Mm-hmm.
right? So if you think it's mood, we have antidepressants,
Yes.
all these things, but they're kind of a Band-Aid for it. I was a physiology teacher assistant in undergrad, but when I was a pre-med, and physiology is our natural body systems and how they work and how all of these chemicals, hormones, everything interact. And so hormone replacement, hormone balancing is beautiful because we're looking at how the body actually works. And instead of bringing kind of a foreign substance
Synthetic, yeah.
like fluoxetine or sertraline to increase,
We are replacing.
to increase
with
your
the body.
serotonin,
Yeah.
we kind of go down and say, oh, well, it looks like the ovaries are slowing down a little bit. It's not making
help.
enough
Mm-hmm.
progesterone. And so we supplement that with a natural hormone
Bioidentical hormone.
to raise that up, and helps people to feel at their optimum. And we always tend to throw that out like, oh, we want you to feel like you're in your 20s or 30s,
Yes.
even though you're in your 50s. And that brings me to the American healthcare system, when we look at the lab results on all these, it'll show the range for a 48-year-old female, and it'll be normal. And everybody's like, "That's great, we're normal for a 48-year-old," but
I don't want to feel like
you
a
don't want to
48-year-old
feel
woman.
like a 48-year-old. You want to feel like
a 20-year-old woman.
20-year-old. Watch out, everybody. So we supplement to target those ranges closer to those 20s and 30s numbers, instead of just saying that it's normal, because you do have the average levels of a 48-year-old, and then give you some Prozac to try to increase your serotonin.
So that's what happens to a lot of women when they go to their primary doctor. Oh, you're just depressed. Here's an antidepressant. Your hormones are fine. You'll be okay.
Yeah. And then what everybody works on is their weight. And so there's a key hormone for your weight loss and muscle mass. That's testosterone. And it, no matter what, decreases as we age.
Yes.
In our mind, we think of men over 40, it's going to start decreasing. And it's, some of us, it's difficult to lose weight normally. Now we're having lower testosterone,
Makes
so
it
it's
more
worse.
Harder.
But what is really overlooked is the testosterone for ladies.
I know.
Because they just have a little tiny bit, and that decreases.
And then you have nothing. No motivation, no muscle mass, no energy.
Right. And they're miserable.
No sex drive.
We have a couple that's been married for 20 years that keep a safe distance from each other because it's not enjoyable anymore, the intimacy. And they think that their wife doesn't love them, or they have trouble in the bedroom. And it's really a simple fix with a little cream for the ladies. Guys can do some cream that they put on their skin, like their leg, their arm, their abdomen each morning. We also can do the shots for men. The shots are usually twice a week in the thigh with a pretty small needle. It's not too scary. And that can, I tell you, the ladies that are on the testosterone, they swear by it. They're like telling their friends and everything, but it's just so few and far between that it hasn't gotten out there.
I know.
They just did a press release from the White House and the FDA that they are basically have been wrong about female hormone replacement for years. And
25 years.
Yeah, they thought that estrogen supplementation would cause cancer, and there's actually a ton of health benefits from estrogen and progesterone.
Absolutely.
They're even finding that the progesterone is beneficial for your cholesterol. And so even men need to have a little progesterone. We don't always have to supplement them with progesterone, but through the pathway of testosterone, we get their testosterone where it is. Kind of a byproduct of that is a little more progesterone that helps with the longevity and cholesterol and
cardiovascular
so
health. Yep.
We'll have to make a presentation about that. I'll show all the physiology pathways of this. But today we just wanted to talk an introduction over hormone balancing. We'll make it real easy. We're going to let you come in for a free consultation.
We talk about all your symptoms, have a little one-to-one
narrow
conversation.
It down. Then if you want to proceed, we'll get some labs and we will get those results, discuss everything in detail with you, and come up with a plan.
Yep.
And try to
help
bring you back to
your
health.
20s. Yep, that's the goal.
So
I'm feeling
go
good.
ahead and
I'm feeling good.
Like and subscribe and contact us for a consultation. We can do it over the phone or video if you're distant. We can take care of this anywhere in the state of Florida. So
well,
thanks for coming.
Thank you for having us.
Tuning in
Thank
today.
You for having
we'll
me.
See you next
Thank
time.
you for coming.